Hello everyone, welcome to Skype, no, LangFort International Academy with a new name, new form and lots of energy. So today we are here with a role play and joining me is Sumi, one of our students, and she recently cleared the OET as well. So the setting is at the hospital ward wherein a patient who underwent a cholecystectomy surgery is recovering and is slated for the discharge later on, and the nurse is here to do an assessment, and obviously the part of the nurse would be done by Sumi, and as usual I'll be the patient. So let's see how things go. So shall we?
LangFort International Academy, your passport to the world of opportunities.
So shall we start?
Yes.
Okay, go for it then.
Hi, good morning.
Morning.
My name is Sumi. I'm the nurse on duty today, and now I'm here for assessing your progress.
Okay.
Okay. For the confirmation, may I know your name and age?
Certainly, my name is Randy Orton and I'm 38.
Is it okay if I call you Mr. Orton?
Yeah, that's totally fine.
Okay, thank you, Mr. Orton. Could you please tell me, Mr. Orton, how you were experiencing now?
I'm not feeling good at the moment. I'm in some severe discomfort post this surgery.
Oh, I'm extremely sorry to hear that you are experiencing some kind of difficulties, but try not to worry regarding that. Is it okay if I ask some more questions regarding your condition?
Obviously, you can ask me.
Okay. Could you please tell me, are you experiencing any kind of pain right now?
Yeah, that's true. I'm experiencing some kind of pain.
Oh, I'm extremely sorry to hear that. And if I were to give a pain scale for you that ranges from 0 to 10, and 0 is absolutely no pain and the 10 is the worst pain you ever experienced, where would you rate your pain?
I have to say somewhere around a 5. Yeah.
Oh, I'm sorry to hear that you are experiencing some kind of moderate pain. Besides that, have you been experiencing any kind of other symptoms like nausea at all?
Yeah, that's right. I mean, I feel nauseated most of the time actually.
Oh, I'm sorry to hear that. But I could say that all these symptoms are the after effects of these anesthesia medications. But I could say that these symptoms are mild and temporary, and it will be subside soon. Do you get my point?
Yeah, I do understand what you're saying.
Okay. Is there anything else you would like to ask from my side?
Look, I've been experiencing this pain, right? So I need some relief. So could you actually give me some kind of medication for it?
I do understand your situation, Mr. Orton, but you were already administered some kind of pain medications, but the effect of this medication will be set in within some time, and there will be a reassessment for you after some time, and if it is necessary, we will provide you further stronger medication for you. How does that sound?
Okay, that sounds a bit assuring actually.
Okay, is there anything else you would like to clarify from my side, Mr. Orton?
Yeah, that's right. So look, I've been on this liquid diet right now, so when would it be possible to shift on to, like, say, something a bit more solid in nature?
I really appreciate your concern, Mr. Orton, but I could say you will have to continue this liquid diet a bit more, and if you are not experiencing any further symptoms like nausea and all, you can definitely move on to some semi-solid diet. I hope I am making sense to you.
Yeah, I do get what you're saying.
Okay. Would you like to ask anything else from my side?
Yeah, I just want to know, like, when can I actually be discharged, because I'm very eager to go home.
I can understand that you are so eager to go home, but I could say that before that your doctor will be assessing you, and if after 3 to 4 hours of passing the urine, if you have no other issues, you will be discharged. Are you able to follow my point?
Yeah, I do get it what you're saying.
Do you have any other concerns furthermore?
Just one final concern actually, like, once after I'm discharged and I go home, is it likely that I could develop some kind of complications as a result of this surgery?
I can perfectly understand your concern, Mr. Orton, and I could say you might experience some kind of symptoms like bloating, nausea, vomiting, and even diarrhea. But I could say that all these symptoms are quite temporary and it is absolutely manageable. And if you feel any difficulty difficulty to manage these symptoms, I would say you will have to take an immediate medical attention. Is it okay for you if you do that?
Yeah, I'm fine with that.
Okay. And also I would suggest you have to take adequate amount of fluid in order to aid your recovery. Would you be able to do that?
Yeah, I'll take note of it. I'll make sure that I do take adequate quantities of fluid.
Okay. Besides that, Mr. Orton, I would like to give you some other suggestions. Is it okay for you?
Yeah, I'm all ears. You can tell me about it.
Okay. The first thing is that there should be someone to accompany you when you get discharged. And the second thing is that for the first 24 hours, there should be someone to provide you adequate care. Let me know if you have someone to support you with.
Yeah, actually my mom is there. She'll be the one who'll be providing me all the care that I need.
Oh, I'm extremely happy to know that your mom is with you to take care of you. And now I hope I have cleared everything for you, isn't it?
Yeah, pretty much everything is clear.
Okay, then let me reassure you that there's nothing to be overly concerned regarding with your condition, and make sure that you are taking adequate fluid and you are receiving adequate care for the first 24 hours. I hope I have made everything clear to you, and right now I'll be leaving, and if you feel any discomfort, please feel free to press the buzzer beside you, and till then take care, and I wish you a speedy recovery. Thank you.
Thanks a lot, nurse. Well, that draws to a conclusion our role play for the day. So let us know what you thought about it. So just drop in the comments section, and we will be going through it. Besides that, we need all the support that you can give us. So what you can do is just like, subscribe and share. Anyway, Sumi, it was such a pleasure to have you here. I know you are a very busy person, and it was a really great thing that you could come and help here with the role play. And also, on the part of the LangFort family, we extend you all the best for your future as well. Okay. Anyway, we will be back with more such videos. So just remember the name. It's LangFort International Academy, your passport to the world of opportunities. For the time being, it's Nigel with Sumi signing off. Bye-bye.